Hello, everybody. I am so excited. We've got Jenny Wilson. She is the Democratic candidate for the U.S. Senate here in Utah. She is also a sitting member of the Salt Lake County Council. We're really fortunate to have her today. She's facing none other than Governor Mitt Romney. This is an important race in Utah. There's no question Jenny is a bit of an underdog, but you want to hear her story. Stick around.
Welcome to Your Mark on the World, bringing you another changemaker with champion of social good, Devin D. Thorpe.
This episode is made possible via the support of our sponsors, including Johnson & Johnson's Caring Crowd. Jenny, welcome to the show.
Thank you so much. It's so great to be with you.
Well, it's an honor for us. We're thrilled to have you and excited to hear more about your campaign. Why do you want to run?
Well, first I should point out that we are day one in the general election because Mitt Romney actually won his primary yesterday. So this is our first day. And I'm not sure, if this is going out live at this moment or if you're going to do a delay.
It'll air next week. So it'll be about a week into the campaign. But as we record this, it's day one of the campaign.
So I'm excited to be at this point, having been in this race for a year. And I think I'm like many of the couple of thousand of women who stepped up this year that are jumping into these races that want to see government change. And I really just felt compelled some time ago to get out there and share the vision that I have for the state of Utah.
Well, Jenny, there are three issues that are particularly important to me and my audience. The first of those issues is poverty. And, we don't think about poverty unless we're really thoughtful a whole lot, especially in the United States. We think of that as a thing that happens elsewhere, but Salt Lake has a chronic homeless problem. In fact, every city in Utah has a chronic homeless problem. And that isn't, what is it? Something like 20% of our kids live below the poverty line. Poverty is a real issue, even in Utah, certainly across the country and around the world. What would you do as a U.S. Senator to help alleviate the problem of poverty?
Well, I'm glad you asked that question, and I'm going to answer your question. But first, I want to touch on some of the things I'm currently doing, because you're absolutely right that Utah does have a poverty problem and a challenge. And, just last Memorial Day, not long ago, my staff and I went and served meals that day to the homeless. And it is so meaningful to have the time to engage with people directly and hear their stories. And, there are clearly people who have addiction challenges among the homeless, but many don't. And I remember two gentlemen in particular that I had a chance to talk to at length that were just waiting for housing. Well-dressed, not using, really, really wonderful people who would serve the community and had a couple of health setbacks and were unable to work. And, I remember these two and others that I see on the street and meet. And, my husband and I spend time in downtown Salt Lake or other community streets and what have you in our county. And we're always, when we're able to take a minute to chat and kind of learn. And I think that level of engagement is very important. And I have taken my work on the opioid crisis, mental health, substance abuse, our jail reform very seriously, and have worked in my past for an organization called Voices for Utah Children that works on benefits and support to low-income people. So it's where my heart is. It's very much a part of my candidacy, especially against Mitt Romney, who I think has served in other places and may have not had the chance to really engage at that local level as I have. But to the federal question that you ask, I think there's a lot that we can do. I feel concerned right now as a Democrat watching this president that we're moving backward, not forward. So I hope that really well-intentioned Republicans who see things differently than our president on these fronts will be willing to step up and hold the ground and we don't lose too far on things that matter. Medicaid's a huge piece of the puzzle, as you know. Good health care and access to health care is key. So we have to make sure we don't turn the clock back on that issue. And then, programs that support people. We've always debated and talked about, government assistance and what's the appropriate level. But when we have college not affordable for people and they don't get a higher education and we have barriers to education and we're not doing enough to support a pathway for people's success, we're going to have more and more people in need and our numbers are going to go up and not go down. So I think really as a senator, and I've worked already on the Hill, I worked for a congressman for several years as a chief of staff, I understand the federal government. We've got to hold on and support those programs that really allow people to just have stability. And it's everything from Medicaid to education to how we manage our welfare and our food programs. And the hits that we're seeing now by the administration are devastating to food programs. So I live concerned every day about these, and it is very much one of the reasons I stepped up. We need people in Congress that get it, that are serving our citizens, that frankly care, and I do, and I'm desperate to serve for those reasons alone. I hope to be a U.S. Senator, serve our state, but what I want most, if it's not me, is that if it is Romney, that he does care about these issues, and he will be an advocate for people. And I'm working to be there, and I get that this is a very red state, but we have to be charitable.
Sure. Now, Jenny, the second issue that's important to me and our audience is healthcare and public health. And, Utah is one of the several states that opted out of the Medicare expansion. The president's recently passed tax reform bill, some would argue, gutted Obamacare by removing one of the three pillars, the mandate. So now people can opt not to buy insurance, leaving only the sick in the Obamacare pool. This is kind of a scary situation for a lot of people in terms of healthcare. What would you do as a U.S. Senator to help get more people better access to healthcare?
Well, again, you're touching on things that I work with on a daily basis. I have been one of the advocates for our state to expand Medicaid from day one, a full Medicaid expansion. And I work on jail reform, and I look at, I'm also one of the 9, our county council serves as our mental health authority for the region. So the Medicaid expansion is vital for us to be able to cover the need in our community. Like most communities in this nation, if not every community, we are heavily impacted by the opioid crisis on top of everything. So in order to stabilize the impact from the opioid crisis and move forward, that Medicaid expansion gives us an ability to provide healthcare coverage for that next level of people who are not receiving that care. We have a ballot initiative, and it has a very good chance of passing. The necessary signatures were reached, so now we'll be able to ask our citizens this November, do they favor that full Medicaid expansion? And it will be absolutely game-changing if we pass that. So at the federal level, I think what we do and what we should do and what I support is maintaining the Affordable Care Act's coverage and that Medicaid expansion, and continuing to, where we can, expand the market, not regress it as we did with the move that passed and that the president enacted to pull back the requirement. So stabilizing the markets is really key in the state too. We have 2 major health delivery systems in the state: University of Utah Healthcare, and then our Intermountain Healthcare program. And those 2 entities have good leadership, and they work towards cost containment. But I think where I can advocate as a Utah senator is methods and system to our healthcare plan that enrich those programs. There's some things that can be done related to aligning mental health more directly with general health. And those are issues of concern to me. We've waited for dollars to roll out on the opioid crisis, and we've waited too long. And unfortunately, with the budget mess that we're in, the cycles of when that funding can come through are hard to be administered down at the local level. So the grants that we would ask for are sometimes not easily applied for because they tend to come with very limited application deadlines. So we just need to be more flexible, get money out in the states and the communities for treatment, and that's really key. I additionally believe that we are a state and we are a nation that can do more, back to that mental health issue, to mental health parity, insurance reform. We need to make sure that the drug companies are accountable. There's so many things that need to be done in this space. And again, I fear that we're falling behind, and my advocacy and my candidacy is very much about serving as somebody from the new generation who wants to do things differently. And I think I would have a big impact for the state of Utah on health, mental health, substance abuse issues.
Third issue, Jenny, is climate change. You have a little bit of a sticky situation in Utah, and that there are so many people who either don't believe that humans cause it or don't believe that it's happening at all, that talking about climate change that basic idea becomes difficult politically. But in fact, 97% of scientists agree the Earth is warming and that humans are causing it, and that we are in almost a state of emergency scientifically in terms of a need to reduce carbon emissions rapidly. What would you do about carbon emissions and climate change as a U.S. Senator?
Well, it's one of those issues that I feel under the Obama administration, we were making some inroads. The agreement on the Paris Accords, where we are advocating internationally and using our leadership role as a nation to, along with European nations and others, to encourage some nations that are polluting even at levels beyond our levels of pollution in the U.S. So I fear that we made a very wrong decision by pulling out of that agreement. So one thing is to get the conversation back and to get a conversation going again to our world partners that we are committed and that we will continue in our country to work towards alternative energy development and support technology change. And, we do things that are simple but meaningful at Salt Lake County by, putting in the opportunity or many fueling sites for electric vehicles, trying to diversify where and how our energy is produced. We are a victim of coal mines closing, which is a challenge and a good thing. We want to see coal diminish because of its environmental impact, but we also have challenges in job retooling and making sure people are not out of work in those communities. So these are all things important as it relates to, and you made an important point. There are climate change non-believers, and I think in this day and age, that's just not reasonable. And it's frightening. We do have an emergency on our hands. I'll point out that we have an additional challenge here in Salt Lake County, and that we are very prone to inversions. So our reliance on the EPA and its non-attainment guidelines for our community is critical. If the EPA regulations are pulled back further, I worry that our local governments will not be in compliance. Our air will only get worse and worse and worse. And we have a lot of growth on our Wasatch Front. So we need to go further, not behind, require those oil companies and the refineries to operate in a way that utilizes the best technology possible. And sometimes that's a requirement and you have to use the stick, not the carrot. So that's an area that I'm very concerned about and believe that we can do more. And, I hear Mitt Romney talk about how great it is that we're deregulating. Well, I feel the reverse of that. I think we're risking our health and our livelihood and our economic prosperity as a state by moving backward, not forward on that very issue.
Jenny, you've had an impressive career, young as you are. What is the most important lesson you've learned so far?
I think to listen to all sides. I feel I have deep convictions in my 52 years on, being a mother, working in the community, having an opportunity to work in Washington, D.C., having the opportunity to work with labor unions and activist groups and work on healthcare and other issues. I have a very strong belief, but I also know that there are people who come to the table have a different point of view. And, I grew up, my dad was a mayor, so he was the guy that had to get along with everyone. It's what a local official does. And I think I learned from that people always have something interesting to say. It's important that we listen. And I hope convince you that I care very much about those three issues, but I'm always willing to listen to the other side, see if we can find areas where we agree, find that common ground, and move forward with those policy solutions. And that served me really well to date as an elected official.
Jenny, you're obviously super bright and super capable. You could be doing anything and you would prosper at it. Why have you chosen public service?
Well, I think that's where I have an impact. I did have an opportunity. I served 6 years on the Salt Lake County Council, and my kids were getting a little older, and I thought, well, this is a part-time job. I think I want to go back to a traditional career. So I took a job at the University of Utah's Healthcare Center, and I was the lead for fundraising, marketing, communications, government relations for the ophthalmology division. So I learned a lot about ophthalmology, and I felt like I was really impacting health and access to health for our residents. And we launched an international program, and we provided care to local people who did not have coverage. But I really missed the opportunity as a Democrat to have my voice heard. I'm effective at what I do. I work well across party lines. I know how to cut a deal, and I love policy. And I think I missed the opportunity to be part of a system. And we're a very Republican state, and fair enough, but some Democrats have good ideas. And I think it's time that Utah get back to more balance. So I really felt my calling was, as a responsible Democrat, being part of the system. And that's what led to this opportunity to run for the U.S. Senate. I strongly believe our state is better off by having a Democrat in our federal delegation. We're able to talk to the other side of the aisle. I have a different perspective than the 6 Republicans who serve us in the Senate and the House of Representatives from Utah. And I think that's okay. Our side is doing some important things. You've touched on 3 of them, and I've answered questions on 3 of them. There are more things that matter to the state of Utah, and there's an alternative voice. And fundamentally, I'm doing it because I believe that Utahns need to be served, and that we have a large number of people that the all-Republican delegation is not serving.
Jenny, what is your superpower?
I don't know, my superpower. Well, I was asked which character I would align with recently, and I said Wonder Woman, because she does it all. And so I think, I don't know, maybe have bionic listening ears or something. I'm a child of 70s television, and I love the Bionic Man and the $1 Million Man and the Bionic Woman. So maybe it's a bionic listening ear.
That's great. That would be a great tool. Well, Jenny, we really appreciate you taking the time to be with us today. I know you've got to run, but before you go, would you take just a minute and tell people how they can learn more about your campaign, donate to the campaign, and connect with you personally?
Great. Well, thank you. And I take a lot of pride in the fact that I have thousands of individual donors. That's a major difference between me and Mitt Romney. I have a citizen-based campaign, and our website is wilsonforsenate.com. So go to my website, and we've got donation links and volunteer links, and it'll get back to my amazing team. And we're just loving being a part of this, traveling to all 29 counties, listening to what people need on the ground in the state of Utah. And if your audience is interested in my campaign, I would love to engage with them.
Fantastic. Well, Jenny, we wish you every success in your campaign, especially in your efforts to reduce poverty, climate change, and improve access to health care.
Thank you so much. And I appreciate you and the work you're doing. Thank you.
Thank you. Now, let's do some good.
At Caring Crowd, we believe everyone has the power to make a difference. Through our crowdfunding platform for community health, we empower passionate people to drive real change. Whether you work for a nonprofit organization, volunteer, or want to get involved for the first time, you can post a campaign on Caring Crowd. Join us, because caring is where change begins.
Thank you for listening. This podcast is available at youtube.com/Devin Thorpe. Subscribe to this podcast on Stitcher or iTunes by searching for Your Mark on the World. Every weekday, Devin hosts a CEO, celebrity, entrepreneur, or other changemaker here on the Your Mark on the World show to inspire and prepare you to make your mark. Devin is a champion of social good, writing about, advocating for, and advising people who are doing good. He is a Forbes contributor who is a recognized thought leader in social entrepreneurship, impact investing, and crowdfunding. To book Devin as a speaker, visit devinthorpe.com.